Hi girls, I'm doing my 10-week vlog. I just got back from my doctor's appointment, my high-risk doctor's appointment, and I am 10 weeks and 2 days today. And first let me tell you, they did my blood pressure was fine, and then the lady tried the Doppler, and she was going like right below my belly button, and like to the left and to the right and stuff, and she was like, she tried it for like, it felt like a minute, and then she was like, oh well, it's still early to not find it. And I was like, and she was gonna like just wipe off the gel right then and there, and I was like, can you try a little bit lower? And she like tried like a smidgen lower. She's like, oh, maybe the other woman can find it. And so like, of course my heart is racing, because let me tell you, on Tuesday, exactly at 10 weeks, I was still very sick, like all day sickness. And then yesterday, Wednesday, I woke up and I felt so much better, and I was worried because, you know, of course you're going to worry if it just goes away like that instantly. And so that's why I was extra worried once you couldn't find it. So then the other woman came in, and I told her, like, you know, I think the other woman was trying a little bit too high, because I can feel the top of my uterus, you know, at least I think I can. And so she tried it, and within like 20 seconds she found it, and she's like, hear that? She's like, that's your baby's heartbeat. And I was like, oh, what is it? What's the number? And she was like 169. And I was like, oh, awesome. And I was so much more relieved to go from like, oh, I can't find it, and like the lady just being like, oh, it is early. I wanted to take it from her, like, let me try, like, I know I can find it. And then I met with the doctor and I went over all the blood tests I've had in the past, like the blood clotting disorders, and we went over the chromosome problem that I had with my last miscarriage, and he basically just explained that it's, you know, sounds like it's a pretty fatal chromosome, but it looks like it's a pretty common chromosome problem, trisomy, and so, lost my train of thought. Okay, so he said that, basically he described it as, it was either a translocation on my fiance's sperm, like in his genes or something, and because I had my karyotype 9 and mine came back normal, at least, I don't know how specific of a karyotype they did, like if they looked for translocations or anything, or I don't know how all that works, but he said that it was probably most likely just the egg and the sperm when they met and started, sorry to fly, when they met, that they just didn't join properly or something, and that's what could have caused it. And so I asked him about, like, I remember last week I was telling you about that doctor, the high-risk doctor they sent me to is like 25 minutes from my house, and it's right next to the hospital that I don't want to deliver at. I want to deliver at the one that's like a mile from my house. And so I talked to him about being labeled high risk. You know, how long does he think I'm going to stay high risk, or does he think that I'm going to get transferred to, like, you know, normal level pregnancy? And he said basically, majority of times when you make it over 10 weeks, you're usually good. He said usually. But he's like, let's keep you here for the next, you know, few visits. So probably after I think he said level 2 ultrasound or something like that, which I'm assuming is probably like the 16-week one, because I'm going to do the combination, the nuchal scan. I believe I'm going to do that within the next few weeks, and then I think you do a follow-up one. At least the one that I chose to do is like a follow-up one that I think you do like 16 or 17 weeks or something, and they do the blood tests and combination and everything. So once we find out that my chances are, you know, pretty low, hopefully we'll find out they're pretty low of being some type of chromosome problem, then he doesn't see a problem which allowing me to go to the office that's right next to my house, and level. So I might be high risk for now, but then I might be switched to the normal level, which I know high risk would be more exciting to the fact of getting more ultrasounds and being seen more often. But I think it's more important for me to be able to deliver right next to my house, and the doctor visits being right next to my house, and establishing one doctor basically and a midwife if I can. So I'm not constantly shuffled to different people, so then I don't have to explain my story, and even though they have my chart, but I don't have to explain my story over and over, like, oh, this is what I had in this. I want somebody to like go through this whole process with me, like one or two people, not I've seen like everybody at this one group. Like, it's crazy. It's kind of nice because it gets you in faster when you are willing to see anybody, but I'm to the point that like I want to stop getting shifted around and somebody know exactly what's going on. And the other good news is, or I have two good things. The doctor said because my morning sickness just kind of settled down, it went from like a 9 to like a 3 overnight, he offered an ultrasound today. So I was like, okay. And so let me show you the picture. So you have the glare again, but on the left is the little head, and you can see like, and it's facing up, like it's laying on its back, and you can see like a little hand. And the woman, I was like, oh, I can see his hand, and she's like, oh, it's actually just buds at this point, it's too early. I saw finger shapes. I don't know if it's the bones, and then maybe it's still connected like webbing or whatever, but I saw the 5 little fingers, and the little body you can see is on the right, and the heartbeat was 173, and the size crown to rump length was 3.5 centimeters, which I looked online, the conversion in inches is 1.37 inches. So I was excited. I got to see baby again. I got to see baby last week, and I got to see baby this week. I don't know when I'm going to have the next one. I'm assuming it's going to be in the next few weeks so that I can get the nipple scan. And the other exciting thing is online. I don't want to tell you what I found, like where I found yet, because I want to find out if it's legit and if they have any available and more information about it. But I found a nonprofit that if you've had losses, stillborn, miscarriages, or if you're considered high risk, they have Dopplers that, as long as you get a prescription from your doctor and saying, you know, like fetal Doppler on it, then they will send you a Doppler to rent for free, like when you turn 12 weeks pregnant, if they have one available at the time. And then you have 4 weeks after delivery to return it. And so I'm super excited because you all know that I've been looking for a Doppler and I can't necessarily afford one right now. So that would definitely help a lot with my mental state, so that I know that I can find baby's heartbeat every day and make sure everything's okay, and then that will help me in between all my doctor's visits. Let me think if there's anything else. I did a belly shot on Monday on Halloween, but I'll do another quick one and then I gotta go. From the front, shirt up. At this point, I know it's TMI, but I think it's more constipation. All the intestines and everything I think they're moving their way up. So, alright, well, thanks for watching, girls. I hope everybody's doing well, and baby dust, sticky dust, and prayers for everybody, and I hope you have a good afternoon. Alright, bye girls.